In this video, we're going to be talking about some things that you can do if pregnancy is causing sciatica. One of the first things that we may want to consider is the pain actually sciatica? Because that's something that sometimes we can get confused about. Most of the time during pregnancy, there's pain in the lower back or pain almost, we'll call it at the sacrum. And actually, I'll show you. And we look at our sacrum, we have both sides of the pelvis and we have our sacrum here in the center. And a lot of times we start getting pain on one side or the other side here. And we think that's sciatic pain, but actual sciatic pain may start here in that area or along the lower lumbar vertebra in the spine, but then that pain then travels down the leg. Sometimes it hits the hamstring, sometimes it goes all the way down to the feet. But that's the kind of pain that accompanies sciatica, not just pain that sits here. Sometimes that's just SI joint pain, which also can be really serious, but it's a little different than sciatica. So now let's talk about some things that we can do. So when we're struggling with sciatica, I tend to give exercises that create extra extension in the spine. However, some of those extension exercises involve you lying face down on the floor or in the bed, and that's not something you're going to be able to do during pregnancy. So here are a couple of things that you can do that can help. The first exercise will be extension using a towel. So you'll wrap the towel or a sheet or a blanket or something around the lowermost part of your back. You'll pull with both arms and you'll just lean back and start to extend the back. That should relieve pressure. Any of these exercises you do, you should try, see if it feels better. If it does, great. If it bothers you, stop and talk to your doctor about it. Another one would be using something like a countertop. If you stand with your back up against the countertop and just lean back over top of it, that'll provide a nice fulcrum for you to get really good extension. Again, this exercise shouldn't be something that hurts. Now, sometimes when we do this, these kinds of exercise, it may feel just a little bit worse in the back. But if it relieves that pain and pressure down the leg, then that exercise is just fine to do. But again, talk to your doctor about that. Next exercise, lie on your side with your knees bent. The top shoulder, start rotating that shoulder back so you're working on getting your back flat onto the bed or the ground as you're in this side lying position. Again, that should relieve pressure and feel good. So for this exercise, it's called nerve flossing, and you're working that nerve through the area that might be impinging it, almost like flossing the teeth. This is a hard one to imagine, but here's how you do it. You want to sit in a place where you have plenty of free movement of the legs, and you're going to start to straighten out that painful leg. Now, normally straightening out the painful leg is going to be a problem, but as you're straightening that leg, you're going to also lift up your head. As you're lifting the head, that relieves some, it gives a little bit more slack in that nerve along the spinal column, and so that sciatic nerve will be able to travel forward and backward. If you slowly bring the leg out and lift your head, then you bring the leg down and lower the head. Do that exercise for about a minute. And again, just like all the other exercises, you should be able to do this and it should relieve pain and pressure. If at any point it bothers you, again, just stop. So there you go. We got a few exercises that will help you to relieve sciatic pain if you're pregnant. If you have any questions, leave it in the comments. If there's something that you've tried that's been a big help with your sciatica, we'd sure like to hear about it, so leave that in the comments. And if you like this kind of content, just go ahead and click that like button. You can subscribe to our channel so that you can get alerted whenever the next video drops, probably next week. And we're gonna create the best community in natural healthcare together. I'm Dr. Emil Tompkins. Hope you have a great day, and we'll see you in the next video.